Good afternoon, everyone. Welcome to our Talking Tuesdays. Actually, it's morning. It's 11:59. We still have a minute. Hi, Anshika. Hi, everyone. We have a very special Talking Tuesday today with our special guest who will just be joining us in a minute. Let me check if she's around. Our topic for today is touch therapy for breastfeeding, birth imprints, and resonance between the mother and the baby. So it's a very, very special topic. I hope you all will enjoy listening to her. Let me just check if she is here. Okay, let's just wait for another minute. Okay, let me just ping her as well. Hi. Hi, everyone. Okay, she'll just be joining us in a second. Yes, there she is, and I'm okay. We just wait. Yes, I'm on a better connection now. Hello, Yasmin. Good afternoon. How are you?
I'm well, thank you so much. How are you?
Very well, thank you. So, I was just telling our listeners today how honored we are to have you today with us for our Talking Tuesdays. And before we start, I'd just like to give a very short introduction of Yasmin. I'm sure everyone knows you
I
with
feel so
the
privileged to
other.
be with you today, Tanvi. I feel very privileged to be with you. Thank you so much.
Thank you so much. So, as you all will know, Yasmin, however, I'll just like to give a short introduction of her. Efat Yasmin, she is one of the leading international board certified lactation consultant, and she's also a biodynamic craniosacral therapist. Her practice is based in Bombay, and she's the founder of Nourish and Nurture, through which she, gives supports to families when they're seeking for some professional lactation help, and also parenting counseling and CST therapies. If I have missed out anything, Yasmin, please go ahead
No,
and
you've said a lot. You've
add
said
to
a lot.
it.
Thank you so much, Tanvi. Thank you so much.
Yes. So thank you everybody for joining us for this special topic today, which is the touch therapy for breastfeeding, birth imprints, and resonance between mother and baby. So let's just start, Yasmin, with just a bit of understanding on what craniosacral therapy is.
Okay. Where do we begin with craniosacral? I think it's what we need to kind of get a sense of, Tanvi, is what are we made of, and how do we communicate? you know I think that's where it starts from, and recognizing that the human system is complete, and it is self-regulatory. I think that's the major thing that we need to recognize, that we are self-regulatory organisms like all other organisms in the world. Now, if we base our understanding from that, then it's easy for us to then start to recognize that, with support, all of us can start to regulate our systems, which is majorly the nervous system. Where there are many theories that are there, like polyvagal theory and other kinds of theories that talk about the nervous system. And we do know that all kinds of illnesses will stem out of stress. That's what is the predominantly understood term, that stress can cause different kinds of issues. Now, what does it mean if we say that stress causes issues? Is the nervous system has to know how to balance itself, and it does know how to balance itself. All right. So if it does know how to balance itself, then what happens is sometimes the amount of information that's getting into the system is not having enough space, time, and the sense to actually start to process itself. So if it's too fast, for example, if you open up a laptop and you're working with it, and you open sometimes, you're browsing, and sometimes you end up having 20 different windows. It does happen sometimes when we start doing work, right? And you're multitasking, and you're creating different kinds of processes at the same time. Now, if your machine is not supported with enough random access memory, which is the table of working, the working table, which is your nervous system, the system is going to hang or slow down. And this is something that we all can understand. It's a simple correlation with what our human system does. Now, the human system also does very similar kind of work, where work is sequential, which means that one work at one time, and then you process it one after the other. Now, that's different if you're shifting between two different kinds of processes in a matter of two or few seconds, right? Now, if we have too much happening in our system, then our system also can hang up. And that's what craniosacral therapy can support you to start to regulate again, or support the system so the system starts to express itself and doing its own function, which is regulation, which is what it does fundamentally. So that's what craniosacral concept is. Now, if you ask me how does it look and feel, then it's a touch modality. Primarily, it's a touch modality, Tanvi. So you use gentle touch, and with presence and mindfulness, you listen into the body, and the body is constantly communicating with you. And this is, again, I want to give you a small example. If you're looking at a painting, for example, and if you're a layperson, you might love the colors or the design, and then you say, oh yeah, that's lovely. It's really nice to see, and it soothes me a lot. But if you're an artist, or you understand the nuances of art, then you start to recognize what maybe the artist thought about, or what was his consciousness when he came up with this piece of art, right? So similarly, as a practitioner, you're trained to tune into the body, because the body is constantly communicating. The communication can happen with sensations, with felt sense, with sensations, or if you're looking for scientific understanding, then in even electromagnetic waves. You're constantly feeling them, and as a practitioner, you're trained to feel them and understand them. And with the presence or resonance, which we are going to talk in a while when we get into the conversation a little more, the body starts to then regulate itself. So this is how primarily how a craniosacral system would therapy would look like. Now, when we explore a little more further, we might be able to step into a place where we recognize that the lesser we touch, the more deeper work you can manifest, which is deeply listening space. So in the last couple of years, Tanvi, my work has moved from touch to no touch. So I started to recognize that I have a deeper process, and I'm able to stay with that process until the regulation happens with no touch. And the lesser I intervene, the more deeper the work is. So in the last 6-7 months, I think we've done 100% no touch work,
I
remote
was
work.
about to say this because you said
Yes,
that it's a
yes.
touch therapy. So how does it work, in situations like these?
Yeah, so because the body, the more and more deeper and subtle you get to the body has many different ways of communication, Tanvi. And so you can feel it from anywhere because we are energy. We are energy, and we recognize that we are energy. Now, again, as a layperson, if I say that if you're walking on a road, Tanvi, and you constantly feel like someone's prying on you or looking from the back or kind of stalking you, you do get a sense of it, right? Not necessarily that you need to turn
Right.
and look at the person, but you still know that someone across the room is watching you or prying on you, and that is energy. And you can feel, there is a field around you and you're constantly feeling it. And the entire body, including your nervous system, is like an antenna. We are constantly feeling, you know and that feeling gives us that vibe. Sometimes we say, oh, you went into a room, but you liked one person, didn't like the other person. Now how? Even though you've not really been introduced, you're constantly feeling the vibes of people. That's because there is energy field, and you're constantly feeling that energy. And the more and more you get tuned into that, what happens is you start to recognize the differences in the way the body is communicating in when it's not regulated. For example, if you've gone through a very difficult time, either emotionally or physically, or you're in illness, it will be different from the way it is regulated, completely settled in wholeness, in completeness, Tanvi. So that's how we can go deeper and deeper. So the more deeper you listen, the more communication you can have. Like we do with animals, for example. We don't talk in their language, but we sense and feel and understand how our little furry babies communicate with us, right? I
Absolutely.
think we all have that sense, but because it's not used in a medical system, Tanvi, I think what happens then is a disconnection in our mind to think, oh, what is this? Is it like some sort of a pseudoscience? We start to think that way. But in real life, you're all the time communicating without words, all the time. Your body is constantly speaking, right? So that's already there. So I think all of us sense that, except that we haven't really stretched that understanding to how illness can be supported. I think so. That's
Right.
where the difference is.
So in situations like these, if you could just help us give some examples as to how you've been supporting women, especially because it's such a stressful times that have
Right.
been happening in the
Yes.
last few
Yes.
months.
Yeah. Yeah. Last few months have been extraordinarily stressful. That's something that we do need to acknowledge. And that is a collective also, Tanvi, that the entire world is going through this time, and it's not
True.
just a few of us, right? So what happens is our bodies, like I mentioned to you, our bodies are constantly like antennas picking up energy from outside. And even if you feel like you're completely in a good situation where you're not really affected either physically or as with illness, current illness that's going on, or even for that matter your job, your finances, or just the family situation, if it hadn't really changed much either, the fact that the whole world is going through a huge amount of extraordinary amount of stress, you are going to resonate with that. Like if you are in a room of people who are angry, it's a mob, and they are protesting against something. Now, you don't have a choice. Sometimes in your body, you're going to constantly feel like you want to join in there. And you feel the same vibes, right? Or if you
True.
are in a room where people are grieving, there is no way that that human experience will not touch you. And you're going to feel very similar to how the whole room is feeling. So there is a collective experience in this, Tanvi. So, in that scenario, to answer your question, we do need to understand that we, as women who are going through, conception, pregnancy, and birth during these times, they need extraordinary amount of help as well. Supporting their nervous system is one of the most critical things that we can do during these times, which are pandemic times. This is going to go down in history because it's changed a lot of people's lives and a majority of the world's life in a collective experience, right? So supporting them. Now, if I give you an example of that, how does it support during conception? How does it support in pregnancy? And how does it support in labor and after? So let me just start with conception. So women sometimes come and say, we have been trying for a lot of time. It's been many, many years, but seems like we are not being able to conceive. They might say that. Now, and during these times, it can be even more exaggerated situation that you're not. There's going to be a lot of couples and families who may have difficulty in conception itself during these times because it's stressful. So the nervous system is like it's hung up, and it's not able to do its regulatory work. It's the function that it needs to normally do, right? Now, how do we support? Again, we approach the body with the understanding that it has its intelligence and wisdom to regulate, but what it needs is a deeply listening space. And through the work, which is again, like I mentioned to you, touch or no touch, you're listening to the body, and then the body fantastically starts to then do its work. And how does it do its work? It starts to release the tension patterns in the connective tissue, in the musculature, in the entire body. And it's sometimes even in the beginning of the treatment, usually it picks up the most prioritized process in the body. For example, if you have hormonal issues, for example, so there could be work that happens, release work happens that happens around the pituitary gland or the endocrine, system, or how those small blockages that may be there in that connective tissue or the musculature or the nervous system starts to release, and then there is more circulation that happens across the body. So in this pandemic, I've been working with a lot of women who have irregular periods. I'm talking about irregular periods since the time they started from the time of puberty. Now, just one session, Tanvi, just one session, and it changes how the entire system works. And they write back to me and say, "Ma'am, this is the first time since the time I started menstruation. This is the first time I have a regular period." So it's that deep. The work can be so deep, and if you trust the wisdom of the body will show you what its priorities are, and we are often not listening to that. So if we start to tune in, then the body then takes over and say, "Okay, I just needed that little bit of listening, and now I'm like I'm able to move, and I'm not stuck anymore in this place, and I'm able to move forward quickly." So that's one thing. So then I had a woman who came in just about 2 months ago, and she started her treatment. 2 sessions later, she conceived, Tanvi, and she told me, these are words that she said, "Ma'am, my doctor had mentioned that I can never conceive." And these are the words that the doctor had told her, that she had some particular problem in her ovary, and there is no chance that she could ever have to conceive. And she was stunned when, within just a matter of 2 or 3 sessions, her body was willing to, start the process of conception. And that's one of the things that happened at that point. And then when you move on to during pregnancy, there are many issues that can happen with women. General discomforts that are there, which could be nausea or morning sickness or back pains, or sometimes headaches. They can have different kinds of swelling sometimes, or thyroid. I think thyroid has become like the prominent one, Tanvi. Young women, even in their early 20s, I see a lot of women going through issues where they are put on, thyroid medications. Either they are on a border level thyroid, or they are completely on thyroid completely, or even sugar levels going up and down. So all of this indicate that your nervous system is not kind of regulating itself well, and there's too much happening there. And so during this process, if the treatment is provided, then your body starts to regulate, to start to settle in. You can do without medications, or you can reduce the dosages over a period of time, depending on how long you have been taking the medications. So that can be done. Nausea can be significantly supported with. So if I have to give you a small understanding of the human body, Tanvi, where nausea usually would happen because your entire system's kind of just throwing up, from inside, because it's not able to support the diaphragm is not able to kind of support the entire breathing aspect, and then settling in all of the things that we take in is not settling in there. So usually with women with nausea, I notice that the respiratory diaphragm, which is it's like a diaphragm, like a very tight, thick, membrane right underneath your abdomen, mid abdomen, underneath your lungs, that tends to kind of release, and immediately they report that their nausea, their vomiting, all of that has almost gone. Like it just reduces significantly. So that's one aspect of it. Now, if there are other issues where there could be preterm fear for preterm labor, and there are a lot of women who have been put on bed rest. So those women can be supported again, where the body can be supported to then connect with the welcoming of the conception and stay there, because there is some communication that's happening between the fetus or the embryo and the mother's consciousness. So sometimes there is a possibility of not sinking in, or the resonance is not complete and it's not feeling complete, and it may feel like it want to expel, and that is what could happen if there is a miscarriage, or those kind of other tragic conditions that might occur during pregnancy. So that can be supported as well, Tanvi. And also, I just worked with a wonderful person. She's actually a breastfeeding counselor and a parenting counselor as well. She just had a baby, and she called me a couple of days before, and she was taking up, a set of few sessions with me, because she had a risk for stroke actually. So she had a stroke before. So she was worried that it might interfere during her laboring process, and she was concerned about that. So we took care of that during her pregnancy. She took about 4 or 5 sessions, and that completely settled in her body, and the fear was no more there. And when she just before she went into full labor, it didn't seem like her labor was going to begin, and she was starting to feel like, oh my God, I'm ready to welcome my baby. I don't know what's happening. My body feels a bit tight, Yasmin. I'm not sure what's happening. I'm feeling a bit nervous about it. So we completed a session together just 3 days, 3 or 4 days ago. And the next day, she was just going to have a regular checkup with her midwife. And when she went and had a checkup, they said, you're already dilated. She was
Wow.
already in, active labor. She was already in preterm labor. And then they asked her to just stay back. And she had her wonderful baby. And then she called me back 2 days later, and she said that baby is a bit cranky, and baby is not settling in. And the process of the birth and such a thing happened that the floor of the pelvic, when the cervix is opening, the water bag in which the baby is, that was kind of pushing against the floor of the mother's pelvic floor. And baby was unable to kind of move forward for some time. And so that resistance sometimes, where the baby's head is moving down and mother's pelvic floor is kind of holding up, and there's a bit of resistance there, if you can imagine that, Tanvi. So those forces had left a little bit of imprint on the baby's nervous system, especially on the head and the neck area and around the abdominal area, and especially the right pelvic area of the baby. So there were imprints there. So when I gave a session for the baby who was 2 days old, quickly the baby released a sequence of everything that happened as an experience during labor and birth. It was so marvelous to stay with that entire process. And soon after that, the mother came back and she said, "There's absolutely no pain in feeding my baby now. The latch was very, very difficult, and the latch was very shallow. She wasn't able to attach. So the mother was experiencing no pain at all, and the baby was able to settle in and not keep crying. So everything changed right after one session."
Beautiful. So
Yeah.
actually, Yasmin, if you could, continuing on the same topic, if you could just explain a little bit more as to how babies feel about, the entire their birth journey. So,
Huh.
while we're talking about the imprints.
Yes. So it's a deeply spiritual experience. The birth is a very deeply spiritual experience. When I say spiritual, I'm talking about how we are connected with the mother. The mother is how she's connected with the baby. And they both have a negotiation to unfold during labor and birth, right? And during such time, it's an inward process, Tanvi. So all the resources of consciousness, which we utilize to interact, to communicate, to connect with the people outside, which is a social engagement, turns inward during birth and labor. And this is something that we do need to talk about. And I think this is kind of mostly missed out because we're too much in the head, and we want information. We want to know the sequence of how the birth happens, like, oh, what's the first stage of birth, what's the second stage of labor, and then how is that active labor happening, how many minutes apart is the contraction. Now if you leave all of that, the body is only experiencing sensations. So leaving all that information out, what we are doing as women, we are feeling the entire process in our bodies. And that's an intelligent, a huge amount of wisdom that's already there, set in us. So if the entire resources then go inward, then the baby and the mother, they are kind of negotiating the dance of labor and birth. So when that happens, what it means is that if the baby is kind of moving through, making its way out from the mother's passage, now that's a negotiation, because the muscles, or the entire the pelvic area of the mother has to allow itself to expand. That's what happens. It's expansion. It's a process of expansion. It's a process of space. It's a process of abundance that needs to happen. Loosen up, and allowing that entire circulation to allow the, just to open that entire area up. So if that has to happen, then the mother and the baby, we need to tune in to the process to allow the mother to negotiate that entire process without interfering in her. Now, if she needs help, of course, we are there to help her. But most help can be done without talking, without really interacting or giving too much information to the brain, because the body is doing its work. And we need to support the body. So movement is very important during labor. So the mother naturally will feel like wanting to move into different positions to allow the pelvic negotiation to happen, like how the baby is kind of moving down. So the baby is guiding and the mother is kind of following. That's why it's a dance, sort of a dance. And then if the mother is resisting, which is where sometimes the resistance is subconscious, Tanvi. It's not something that she is thinking about, but there is a subconscious programming that she's carrying from the time she was a young girl, or images she has watched, or what she has heard about labor and birth, or pregnancy, or what she has watched her society display in front of her. That's what she carries. And sometimes, most often, it's the fear. And what does the human body do as a sensation in fear is to contract. It's to compress itself, like it's constricted, like it comes together. And that's what happens when you get scared, like your whole body just cringes and goes back in, right? Like it's like a turtle just going back into the shell. That's what happens. Now, that would be what a mother would feel if she's threatened, or she's feeling like, oh, this is not the position to be in, or she's dictated, or she's been asked to do a certain way and she's not been given food or nourishment at that time, or she's tuning into her resources, and we're pulling her resources out to constantly keep interacting with her. So you can see she is deprived of those senses and that information that her body is giving her, and we're disconnecting her from that process. And so all of these things can occur. So that tightness, that the compressions, the constrictions, all of these things can make the process a bit difficult or harder, which is where interventions then come, Tanvi. Sometimes forceps is used, sometimes epidural is used to negotiate with the pain, sometimes you may need to use a vacuum, sometimes you may need to have a cesarean section. So all these interventions would then come as predominantly, hopefully, as life-saving procedures rather than regular processes. I hope that it will be used in emergency situations where we need to support the mother at that point. But if you let the mother do her own negotiation inside her body and allow her senses to go inward, you cannot. So this is the same experience you will have if you have a craniosacral treatment, Tanvi. So your resources from outside go inward and you can't connect. There are a lot of my clients who say, oh, I'm lying down and I'm taking treatment and I can't move my hands and I can't move my legs until the whole treatment is done. They feel like they are like frozen or stuck on the table and they can't move. And that's nothing to fear. It's simply because the senses from outside are moving inward to do its healing work. And that's how the body works. And this is exactly how women experience during birth as well. So if we allow this, then we are going to have a lot more supported labor and birth, I would feel. And that's most significant impact of that experience can have on breastfeeding later on, Tanvi. And that's another link that not many women or medical professionals are not aware of, that connection between what happens during birth has an impact on
Right,
breastfeeding
because
later on.
breastfeeding is always looked at in a isolation.
In isolation, yes, it's very isolated. It has its own thought processes with it, like it's almost like a disconnected, fragmented process of process between a mother and baby. There's no connection between what just happened a few minutes ago, for example. So that disconnection and fragmentation in the thought process is perhaps the most dysfunctional approach that we have towards life. And the moment we understand the connectivity and the sort of continuum, which I call the continuity, it's a process, it's a continuous process. And the moment you connect that, then we will look at everything in life in a very different way. Tanvi, everything in different way, not just birth. We will start to look at everything in a different way. Diseases, general diseases or illnesses, we start to look at them in a very different way, because nothing just suddenly comes up. It's always going to be a product of what just happened, or the fundamental of the, which is why a mother who has gone through a stressful pregnancy or very stressful conception, we do need to keep ourselves aware that her environment of the baby has had some imprints, and we need to be very cognizant of that. And when we approach breastfeeding, we do need to keep that in view of what she might have gone through during her pregnancy and birth. And often women tell you in detail, Tanvi, if you ask them how did you feel during conception, during labor, and during birth, and during your pregnancy, they narrate such details of what they have gone through, or how they feel, or how they experience. It's amazing how women can never forget these things. It's just they're so deeply experiential aspects of their life, and they never forget that. And they tend to kind of share with you quite a lot. And then that gives us a view of how to support. How much do I need to support this woman from where she's coming, rather than just looking at a latch and feed. It really shocks me how we approach breastfeeding. Is the baby latching? That's it. Like everything is done. Like, oh, deeply latch the baby, deeply latch the baby. But the mother's like thinking, first of all, why are we in this state where we assume that the mother knows nothing, and the rest of the community is coming to behave as a savior to the mother? That you don't know how to breastfeed, so let me teach you how to breastfeed. I think the fundamental thing is that it's a natural process. If you let the mother and be together without intervening, they know how to negotiate with each other. It's a life process and it's going to happen. We don't have to be the savior there. However, if we are going to intervene the entire process, then of course then you need the continuity of care. For example, Tanvi, if you had a fracture, and I share this example with almost all, I think, almost all my interviews, but I think it's really drives the point across. So I'm sharing it with you as well. That if you had a fracture, for example, now you know that you have to keep your hand immobile for about 6 to 8 weeks for that bone to join in, which is a process, right? So you immobilize it how? By putting a cast on the hand. Correct? But you also know, because the hand has not moved for the 8 weeks, because the bone has to set, you also know that the result of it is that the muscles would have become weaker. So then you're sent off to physiotherapy to mobilize that entire area back again, to make that movement, so to make the circulation, to get that muscle activity to come back to its normal self. So that's called an example of a continuity of care. Now, in labor and birth, what is happening is that you there is an intervention, maybe a necessary intervention during labor and birth, but we forget that we haven't sent them off to do the physiotherapy after, because we have intervened with it, just like the cast has been put, but then after that it's left to them to deal with whatever comes with it. And
Right.
that it needs to be bridged, Tanvi. That's the bridging that we need to do. If we allow that bridging to happen and understanding, I think even if we must intervene to save, to ensure that there is safety for the mother and baby for a specific emergency situation where there may be a necessary for cesarean section or other kind of interventions, then they are not left without support because they know what to do after. And that could be still taken care of. So I think that is very important link that I thought I should share here.
Absolutely. In fact, it'll be really nice for our viewers to know that how babies can be supported, using craniosacral therapy,
Yes.
especially around breastfeeding.
Yes, around breastfeeding, right? So mothers may experience many different things now. As common examples, I'll tell you. Mother can experience like she starts to feel like she doesn't have enough milk, which is predominantly one of the most important reasons why women reach out for help. And there are other issues such as my baby is constantly crying. I don't know what's happening. My baby is not settling in. That's another reason. There could be other reasons where my baby is extremely sleepy and baby is losing weight and not gaining. And no matter what we do, my baby is not waking up, and we have to force feed the baby and literally remove the clothes and make the baby more awake and want to feed. So there's a reluctant baby. I'm talking about a reluctant sleepy baby. That's one scenario. There could be other scenarios where the pain during breastfeeding could be exorbitant for a mother. She could be feeling, sort of friction when the baby is kind of latching and feeding, or there's a pinching or a biting kind of sensation or gnawing kind of sensation that's happening. That can prevent her from, having an experience of a loving relationship through breastfeeding and attachment. That could be preventing that. Then there could be other issues where baby is not passing stools, for example, or not being able to have a bowel movement, very clear bowel movement, or having a colickiness, or sometimes the baby is able to latch and feed on one side but cannot feed on the other side. So there are multiple scenarios like this that could be, or a baby who's not latching at all, Tanvi, who's just unable to latch and crying and shouting and or throwing up. There are sometimes babies are like constantly right after feeds they are projectile vomiting, like they're just vomiting constantly, or they could have reflux, reflux issues that may be going on, or the baby is in a very awkward, or the mother has to employ a very awkward position to feed. For example, the baby, there is no other way but to lay the baby on the bed, and the mother has to get onto her force, almost on like her hands and her legs, and offer the breast in that kind of position. There are a lot of mothers who do that, Tanvi. So all kinds of positions the mothers will employ, or she has to lie down in a certain way, exactly in a certain way on the bed, and only then the baby can feed. So all these are red flags. All these are red flags. So all these babies can be supported with craniosacral, and they could be having imprints of during pregnancy, labor, and birth, and there could be other structural concerns as well, like tongue ties, which is a separate topic, anyways. But what I meant to say is those imprints are felt in the connective tissue predominantly, where I'll give you some of the examples of these issues of non-latching babies, Tanvi, I'll tell you. Now, I had a mother who had come from Bangalore, and they had gotten down from the airport and they reached to the clinic, and the whole family had come actually. So this baby was already 2 months old, had never latched at all. Okay, and she was just sitting there, and the baby just chose to begin the work, because the moment the body senses that someone is listening to you, you start the process anyways. That's how beautiful the human system is. So the even before she could give me the entire history, the baby had already started the process of doing what it needed to do in the listening space. Now, right after the session completed, the entire family had still not settled down. They were still putting their baby bags and things like that. And I said, now lift the baby and try and latch the baby. And she said, ma'am, that's why I've come here, because I haven't been able to do that. So I said, just try. And then she took the baby and she placed the baby, and the baby just latched. And she asked me what exactly happened. Now I said that the entire, the muscles around this entire area, right from the, edge of this jaw, up to the lips, and inside the nose and the mouth, all of the connective tissue was actually almost like constricted, like turned in, if you can imagine what I mean. Like, it's almost, if you take a paper and actually, crumple it up, how would it feel? That's how it felt in the body. Okay, so the moment the treatment started, the entire connective tissue started to regulate and open up and came back to its midline. And immediately the baby was able to latch and feed, because those muscles were not allowing her to do what she knew how to do. So this is how things change, and this is how craniosacral can support non-latching babies, or babies who are constantly crying. And that sometimes usually happens, crying and non-sleeping babies who don't sleep. They come at 15 months, 24 months, or 3 years, or 4 years, children. Mothers complain that they just don't sleep. They are waking up every 45 minutes and they don't know how to go back to sleep. So such babies, if I look at history, back into the history, Tanvi, often I find them to be babies who might have gone through an experience of a vacuum birth, most of the time. So what happens in a birth with a vacuum is, that's an assisted birth, and sometimes it may be necessary, but you're using the cup of the vacuum right on top of the head here, right? So the connective tissue in the body is the entire body is experiencing a sort of a pull towards the head on the top, right? So the diaphragm, all of the muscles, everything is kind of pulled up in a way inside the body, and it's not able to function very well. And those babies, when that pressure releases, they just turn around in just 1 or 2 sessions. Beautifully, they just turn around and say, it's like, ma'am, I can't believe my baby's like calm. Like, how did they go back to sleep without having any other interventions, such as medications? Sometimes these kind of babies are put through scan machines, Tanvi, and it breaks my heart to think about it, that they're put through different kinds of testing. They're put through MRI scans and CT scans. Sometimes little babies, little young children are put through these scan machines to check what's going on. Why are they not sleeping, or why are they crying incessantly? And they have no findings at all, because these machines are technical, but they don't have the human touch to feel the imprints. They cannot feel like a human body can feel. And this is why we need to know that, you cannot underestimate the sensitivity and the subtleness of what human body can approach and connect with other people. It's not replaceable at all, Tanvi. It's not replaceable at all. And I'm hoping, as a humanity, we recognize that. Yeah.
You actually make me very, very emotional, because when you brought up vacuum, in fact, I just wanted to share my personal experience. When my first, child was born, there was vacuum which was used, and I failed to understand why he used to wake up and cry so much, as if he was just like traumatized,
Yes.
and
Yes.
he was not going back to sleep. And so I shared the same with Divya, and it was after almost struggling for a good 1.5 2 months. I almost had that guilt within me to share it with anyone.
Yeah.
That.
Yes. Yeah. Yes.
So
Yes.
I didn't, though. I was so close to Divya. I could have spoken to her earlier, but there was just so much guilt within me that
Guilt. Yes.
I just
Yeah.
could not share that. And when I did, Divya, she just told me that what time does he sleep at night. So I told her that I put him to bed at around 7:38ish. So she used to finish her practice, come all the way 40 kilometers at 9:30 or 10 p.m. at night, and she just gave two therapy sessions to
Yeah.
my son.
Yeah.
And
Yeah.
I don't know
It
what
turned
happened.
around.
It was
Yeah.
almost divine for me.
Yes. Yes. Yeah.
The transformation was just unbelievable.
Yeah, it's beautiful, isn't it? Yeah.
It
So
was
it shows that how the human body can regulate with just little help, just a little bit of help. And it doesn't require too much of complexity to it. And the simplicity, the human body is as complex as it is simple. That's the beauty of it, actually. It's that beautiful that the more complex it is, the more simpler it is as well. So we let's look at what is so more simpler and how can we support the simplicity of conception, pregnancy and birth, and labor and breastfeeding. These are natural processes of life, and we need to revere its simplicity. I think that's where we need to go at, rather than make it complex and sophisticated with machines. Yes.
So I'm just going to take a question now here. First is Neha is asking, why does this work better for some and than the others?
Okay. So there is a bit of, I think she's stepping. So this is what I was thinking about it. Like the order of how the human system is, it's precise and very absolute, like the math. If you understand the subject of math, it's very orderly, right? So it's orderly that way. But yet at the same time, the physiology, which is the function of it, is more like the science, the subject of science. What are we doing? We are looking at the processes. How does it work? So we are looking at that as a human body, right? But what changes the experience of this absoluteness and the physiology or the function of it is the lens of art, which is the belief from where we come from. That makes it unique. So we cannot underestimate the power of belief, Tanvi. And knowing and truly trusting that the body can regulate it's sometimes hard for a lot of people, especially people who are, constantly thinking about the function of it and thinking the function of the body is its absolute self, and it cannot respond to any other thought processes or emotional aspect of it. But that's not true. And that's where I step into quantum physics and other kinds of, where we are touching upon science and moving into the belief system, which actually touches a little bit on spirituality. But that necessarily need not be considered to be a therapeutic process. But I believe that if you have your heart open for new possibilities, and you absolutely without a doubt believe that this is something that will support you, I have not seen a case where it will not turn around. But it is an internal inquiry process. Like if something is not working out, yes, we also need to look at many other aspects in terms of, the experience of the practitioner, what kind of depth of understanding you have, or what's the lens of that subject that they might, because each craniosacral practitioner may be oriented towards a different thing. For example, some may work with autistic children and they have a better understanding about it, or some may work with only adults, they have a different perspective of it. So it's also the depth of understanding, Tanvi. There's also understanding of that. But the other side of it is also important, that you uh, how much do you truly believe that the body can respond. That's also another angle to that. So both of these can play a big role in what's the outcome of it.
Another question is, what are the ways a mother consciously create this healing field for their babies?
Oh yes, that's where the resonance has to come in. That's the resonance. So a mother's body and her senses are completely tuned in to provide a therapeutic field for the baby. Naturally, they are meant to be providing that field for the baby. Now, whether or not we are all in our most regulated, in the sense, in the moment, am I completely regulated, is something that we need to kind of check in with ourselves to see what are we carrying with us in our thoughts, in our emotions, and how are we feeling about this, the experience that we've just had. Every experience needs processing and integration, Tanvi. That's how systems work in the world, not just our human experience, in terms of human experience, but any process needs to have a processing time and an integration time. That when it integrates, then it makes sense to us, to our senses, actually. Now, a mother who might have gone through a difficult pregnancy or a difficult birth, she needs to integrate that entire experience. And if she's not given that conducive atmosphere to be able to do that, or she's not found herself, her resources to allow her to regulate, what does it mean for the woman for her to feel that I can regulate if I can get this kind of resource or this kind of resource. Now, if she's provided that, and one is to recognize that, the second is that you were given that kind of a resource, then she can sink in into her system to allow that regulation to happen within herself. The moment it happens in her system, the baby just simply maps it, Tanvi, just simply maps it. So this we already know as mothers. Like even if you have a 5-year-old or a 7-year-old, you say the day I'm upset and I'm angry, my child is definitely going to be even more difficult on that day. There's going to be more tantrums, there's going to be more demand, and those things are going to happen. So we do know that whatever we are feeling in our body, we are simply projecting that to other people around us. So they are all our mirror images. Everybody around us are just our mirror images. So if there is chaos outside, then we need to turn within and see what we can do about our own systems. And if we can regulate that and allow ourselves to regulate that, that's where it can change. Now, how can she support? If you ask me, how can she support? Um, you know, breathing exercises can definitely make a big change. Or if somebody is already practicing meditation, that can be a huge way to allow the system to regulate. Tanvi, that's one thing you can do. You can use Bach flower remedies. Bach flower remedies. Flower remedies are wonderful, wonderful resource and abundance from nature that provides you, ability to regulate your emotions. No matter how difficult those emotions are, you can negotiate that and allow them to settle in if you know how to use the system of flower remedies. That's another subject that we can talk about at some point. So that can be a big resource for a mother, or she could allow herself to journal her experience. If she has to do it on her own, she can journal her experience, and that can allow her to settle in. There are multiple different ways of approaching that. You can do art therapy, or you can do craniosacral therapy, or you can reach out to a counselor, or you can talk with your midwife, or you can talk to your the support person that's there during the birth time. Maybe your own partners, or maybe your mother or your sister, whoever to whom you can feel safe and you open your heart to. There's regulation. That's definitely the result of it. You can allow yourself to regulate there. Yes.
Great. So, two more questions, and we'll just quickly go through these. First is Sharmila. Sharmila is asking how to make a tongue tie baby to latch perfectly.
Okay, that's a whole different subject. Tanvi, we need to talk 1 more hour then. Yes, so I'm going to give you a small gist of it. Yes. So, I think it's a compounded issue. When we look at tongue ties, we do need to consider that it's layered, Tanvi. We cannot just look at the structure and say, okay, I have a tongue tie, so what do I do about it? How do I latch my baby, or how do I treat this baby? What kind of treatment is available? What are my treatment options for this baby? The first thing is to start looking at everything together as a whole. What is the baby going through, and what has the baby gone through as an experience? If there have been other experiences that may not have allowed settling in and regulation, definitely those patterns have to be first taken care of. Then you're looking at a structure which is sometimes restricted, right? If there is a restricted amount of tissue that's underneath the tongue, which is called a tongue tie, you need to look at therapeutic positions of breastfeeding to allow a deeper, a safer latch to happen for a mother and baby to have a safe experience, while we are still waiting for a treatment to be done. So there are multiple ways of doing that. You can do which lactation consultants usually employ is they do suck training. They use finger feeding to support the muscles that need to be used for a proper coordination of a sucking action. So using a finger and an infant feeding tube, we allow the baby to suck on our finger and give the right amount of sensory input at different places on the tongue that can allow the baby to start to use those kind of grouped muscles together. So that's a technical process, that some of those things are a skilled process. They need to employ that to get a sense of how we can support those kind of babies. And then how a mother can be supported. Sometimes she may need to be in a different position completely, such as, a straddle position where the baby is made to sit on the mother's thigh, and the baby's kind of more in an upright position, to see if that can allow a better latch, which is non-painful if the mother's going through pain, for example. Or she might need to be in a lying down position, or the baby's needing to be in a certain lying down position to be able to support. If the baby's already also has other issues such as sensory issues, you may need to look at many different things. Sometimes babies can't manage touch, Tanvi. They can't handle touch because their sensory system is overloaded. During such times, you can't do a skin to skin contact. So you need to figure out a way how you can place the baby on the bed without a physical contact and just offer the breast. So there are different kinds of therapeutic ways of approaching and latching the baby and supporting the baby if the baby is having difficulty, and especially with the tongue tie, or how to achieve a deeper latch with given scenario where the baby's muscles are tight. So you need to work around with that rather than to force a baby, which is what happens usually in a hospital setup, where the babies are forced to the breast, and they do carry those imprints for a long, long time. And that happened with my own baby. I can tell you that. Yeah, she was forced to get onto one breast, and she refused to ever feed on that breast. The entire 3 years, she only breastfed from one side. So those imprints can happen, Tanvi. Yeah.
Um, Janni Priya is asking, to understand craniosacral therapy, is it something that just is listening to the body alone, regulates the body, or there's another set of other processes as well?
I think predominantly it's listening to the body and knowing well how those processes are unfolding. So you do need to understand even those processes. The deeper you understand the process, the deeper the listening is. So when you say listening in, it's not it is not a superficial listening. It's a deep listening process. And when those processes start to unfold in the body, you're sort of staying there without a judgment, without kind of intervening it, without kind of directing it, to allow it to complete its own process. And understanding those process, and that sometimes will make it much more deeper. The presence becomes much more deeper. I think it's a work of presence. So the presence then becomes a lot more deeper if you understand the processes. Yeah, but basic listening, all of us can do. All of us can do. If you just simply sit down and when someone's crying, for example, your child is bawling and crying and is falling on the floor, the way you can regulate the system is to allow your own system to regulate. So the moment you sit down next to the child and then calmly just take a deep breath and allow the breathing to settle in, you will notice that everyone else in the room will start to match up with what you're doing. So that's something that everyone can do, and all of us should do it. I would feel that all of us should try to do it at least. Usually, we get triggered as mothers, and we also have our own processes that happen. So if we can allow that settling to happen, then we can experience that regulation to occur as well.
Thank you so much. Thank you so much. Anuradha Shetty is writing, the relationship between a mother and child is so, so spiritual. Only if we stop loading her with things to do rather than allowing her to follow her heart and instinct.
Absolutely. It's that she said it all. So it's beautifully mentioned, that whole process of, that resonance and the deep connection of the mother and baby experience. And it's a lifetime. The whole connection is a lifetime, because I also treat adults, Tanvi. So often when they come for specific reasons like illnesses, it's surprising to see that the body is taking you back to its primal experiences. It goes back to the womb experience, the experiences that have happened in the womb, or right around the time that the baby is completing the process of being in the womb and coming out. So those processes have a very deep imprints that can last a lifetime. And when we go back to that, most of the healing for illnesses happen when we go back and touch back into the primal forces. So if it's a 65-year-old person who comes in, you're still taking the history that goes back to their birth. And that is important. Like, we need to go back to see what happened at that point, what went on, what was their experience.